Now we're once again inviting Dr. Ajay Sethi on the show to break down some of those COVID headlines.
Dr. Sethi, an associate professor of population health sciences at UW. Thanks again for waking up early, Dr. Sethi.
Yeah, good morning, Leah.
So I want to start with the future of Dane County's mask mandate. A lot of states making headlines this week announcing that they are ditching theirs, from California to New York, New Jersey. What time would be appropriate for Dane County to ditch its mask mandate? Is it too early?
Well, maybe a little bit too early right now, but ideally we would see hospitalizations come down a little further. The healthcare systems are still feeling the pressure of Omicron. Even though that's receding, it would be nice to wait a little longer before mask mandates are lifted.
Also making headlines this week, the issue of myocarditis. We've talked to doctors on the show about the concern for this heart inflammation associated with COVID-19 itself, but there's a new headline that the Moderna vaccine carries a higher risk for it, though of course very rare. What's your take on this? What would you want parents to know?
Yeah, getting COVID puts you at greater risk for myocarditis than getting vaccinated. The vaccine's also associated with that side effect. It is rare. There's maybe a few more cases when somebody receives the Moderna vaccine compared to Pfizer. And in general, the risk is greater in younger men, younger boys.
And now there's also a new report out that the Omicron variant was found in deer, New York. Does that have any implications for us?
Definitely. So last fall, we learned that in Iowa and Ohio and other states, deer were carrying the virus that causes COVID. And now after the Omicron spike, it turns out Omicron can also infect deer, this time in New York and other states. This means that if deer can carry this virus, if the virus remains in deer, if that becomes a reservoir, it can adapt, it can evolve, and hopefully does not spill back into humans. Because if it did, it could come back looking very different.
Some interesting headlines this week for sure. Dr. Sethi, we really appreciate you providing some good context on these COVID news stories. We appreciate it. Thank you.
Thank you.